Hello everyone, I'm Brittany.
I'm Dane.
I'm Maria.
And I'm Jasmine.
And we are fourth-year nursing students at Western University wanting to address the wicked problem of emergency room wait times. As you all may know, long emergency room wait times are a significant and ongoing concern that needs to be resolved. For the purpose of this discussion, let's focus our attention on the hospitals located within the Southwest Local Health Integration Network, otherwise known as the LHIN. In Ontario, average ER wait times span between 4.1 and 9.7 hours, depending on the patient's condition. Different factors affect ER wait times, including the acuity of an individual's condition, the number of healthcare professionals scheduled to work, the time of visit to the ER, and the size and location of ER hospitals. Improving ER wait times may seem attractive and simple to the public, but it should be acknowledged that complex changes must be made to decrease these long wait times.
Canada is known for having a tax-funded, high-quality healthcare system, but it is difficult to manage ER wait times while also being considerate of the provincial healthcare budget. The current average for ER wait times in Ontario is 5.2 hours, but ER wait times are higher at the London Health Sciences Centre, with a wait time of 5.5 hours at Victoria Hospital and 6.3 hours at University Hospital. Reasons for long ER wait times could be attributed to understaffed hospitals, poor discharge planning leading to preventable readmissions, shortages of family doctors or insufficient clinic hours, budget cuts, and so on. Reducing ER wait times is an attempt to increase patient satisfaction while also optimizing patient health.
To fix this wicked problem, we suggest 3 policies. Option 1. We could start staffing healthcare workers in proportion to how many patients come into the ER. This would improve workflow efficiency. Nurse practitioners and registered nurses should work together to address the less complex patients, while physicians handle the more critical and time-consuming cases. This could allow patients to flow quicker through the ER, as more patients would be seen by using the full scope of practice of each healthcare provider. This policy could be achieved by increasing provincial taxes. More taxes could provide further funding to acquire more nurse practitioners and registered nurses.
Option 2. A policy could be formed to enforce proper discharge planning and education to decrease hospital readmissions. Fewer hospital readmissions lead to fewer people in the ER, thereby optimizing quicker access to care. 67% of discharged patients were readmitted to the hospital based on discharge process deficiencies, such as missing or inadequate discharge care planning, and staff overlooking relevant psychological or social factors that may influence the patient's health. Therefore, we recommend that a policy be made to reinforce the importance of proper discharge planning to staff, as it will improve the patient's overall health and well-being.
Option 3. A policy could be formed to redistribute healthcare spending, particularly with an increase towards public health. We recommend that a portion of the healthcare budget spent in hospitals be redirected towards creating more public health centers, chronic disease management resources, and mental health resources. The function of public health is to prevent disease and promote health by assessing and monitoring communities to recognize their health problems and priorities before complications arise. Therefore, increasing public health resources would likely reduce emergency room visits, as more people would be cared for within the community.
After considering these 3 options as a group, we collectively agreed to implement the third option within the LHIN. As an upstream approach, improving outpatient resources can maintain and optimize individuals' health and therefore prevent emergency room visits. This policy does not require increased taxation, but rather a redistribution of funds toward primary prevention strategies. Primary prevention strategies include health education, immunization, risk factor screening, and the enforcement of safe and healthy practices. As our population increases, primary prevention is essential to reduce the burden on the healthcare system and ER wait times.
Thanks for listening.